Welcome to Lesson 2 of the U.S. Equestrian Competition Managers Training Program. This lesson will provide an overview on recommended biosecurity and isolation protocols at U.S. equestrian licensed competitions. This lesson is provided solely as an informational and educational service to U.S. equestrian licensed competition managers. All policies, procedures, and protocols are the responsibility of the individual organizer. There will be a short quiz at the end of the program to review the covered information. Feel free to print the presentation script and follow along. Biosecurity is defined as a set of preventative measures to help avoid the transmission of infectious diseases in livestock. As members of the horse show community, competition horses are at risk of contracting infections from unknown sources. The horse show environment currently involves constant transport and shifting of horses from one location to another. Typically, in a competition environment, horses are confined to stabling in a relatively small area where transmission of disease can be easy and rapid. By following simple biosecurity procedures, the incidence of disease can be minimized and contained so the health of the competition horses can be protected. This presentation will outline procedures that can be easily used by horse show management in cooperation with owners, horse caregivers, and trainers to achieve the goal of proper biosecurity principles. Prior to competition, horses should be vaccinated for infectious diseases and vaccinations should be kept up to date. Although vaccination does not guarantee protection against equine diseases or eliminate the need for good biosecurity measures, vaccinations are an important part of any biosecurity program. U.S. Equestrian requires that horses more than 7 months of age entering into the competition grounds be accompanied by documentation of equine influenza virus and equine herpes virus vaccinations within 6 months prior to entering the stables. Horses in FEI competitions should be vaccinated in accordance with FEI rules. Horses exhibiting symptoms of illness should be kept home and should not attend competitions in order to limit the risk of transmission and spread of disease. At licensed competitions during check-in, competition staff should verify that horses entering the competition grounds have the proper vaccination records in accordance with GR 845. In the case of vaccines administered by a veterinarian, the exhibitor, upon request by competition management, must provide documentation from the veterinarian showing that the horse in question received the vaccinations, outlining the name of the vaccines administered and the date vaccine administration. In the case of vaccines administered by a person other than a veterinarian, the exhibitor, upon request by competition management, must provide a receipt of the vaccine purchased, which is signed by the owner or agent with care, custody, and control of the horse, name, serial number, and expiration date of the vaccine, and date of vaccine administration. In the case of a horse that is unable to receive either of the vaccinations due to a history of adverse reactions, the competitor, upon request by competition management, must provide a letter from a veterinarian on official letterhead stating that the horse in question cannot be vaccinated due to medical concerns. In conjunction with this letter, a log of the horse's temperatures taken twice daily for the 7 days prior to entering the competition grounds must also be provided. These horses must also have their temperature taken and logged twice daily while on the competition grounds. The log of temperatures should be provided to the competition management, steward, or technical delegate when requested. Horses not in compliance with this rule may be required to leave the competition grounds upon request by competition management. Prior to and after competition, stabling should be cleaned and disinfected. All organic matter should be removed and detergent should be used to clean stalls and stabling areas. Once the area is dry, a disinfectant should be applied. Pay close attention to the application guidelines on the disinfectant and be sure to disinfect well in advance of ship-ins. It is recommended that competition management check health certificates and proof of vaccination of horses entering the showgrounds. Some competitions may also conduct arrival exams and check the temperature of horses as they enter the showgrounds. It is important that during these exams, if conducted, disposable gloves are worn and changed after each exam. Liberal use of hand sanitizer is also recommended. Manure disposal should be far away from the stabling to avoid any contamination of stabling areas. If bit and tack checks are required, riders may be asked to bring their own halters to the ring, and competition stewards should wear disposable gloves for tack checks. Gloves should be changed after each horse is checked, and liberal use of hand sanitizer is recommended. In the event that there is a virus outbreak in the area, approval for visual bit and tack checks can be requested by contacting U.S. Equestrian. Competitions should also have in place an isolation protocol. USEF GR 846.1 requires that all competitions have in place an isolation protocol for horses prior to the start of competition. USEF GR 846.1 requires that all competitions have an isolation protocol in place to protect horses from the potential of widespread infectious disease at competition grounds. Competition management should be prepared for the possibility that an infected horse may enter the competition grounds. In the event that this occurs, competition management must have an isolation protocol placed to protect other horses from contracting the disease. The isolation protocol may include designated stalls on the competition grounds or at a nearby facility. All competition staff and officials must be made aware of the protocol prior to the start of competition, and the steward or technical delegate must supply a copy of the protocol to the Federation with their steward or technical delegate's report. Isolation protocols should be comprehensive and detailed. They should include general competition information, including the name, date, and location of the competition, important competition management contacts, as well as the contact information of the competition veterinarian and state and federal veterinarians. The name and contact information of the veterinary referral hospital, closest veterinary diagnostic lab, and horse transport companies should also be included. In the unfortunate event that the isolation protocol must be activated, it is recommended that there be individuals designated to monitor the health of the horse while at the competition, as well as individuals monitoring and securing the isolation of the impacted horse or horses, and designated individual managing the communications regarding the incident. It is important that isolation areas be separate from the general population of horses at the competition. In the event that isolation areas are needed, it is recommended that there be space available to accommodate at least 1% of the attending horses, or at least 10 stalls available for use. Stalls should be solid-walled, constructed of hard, non-porous material, and stall floors should be mat covered. Isolation areas should have a perimeter fencing or boundary that is clearly marked with the appropriate signage, and dedicated personnel should be assigned to the isolation area to control the admittance of individuals, horses, and items in and out of the restricted area. Specific feed, water, and bedding should be designated for use strictly in the isolation area, and these items should be stored in an area close to the isolation area. Prior to the start of competition, consider having on hand or plan to obtain supplies for your isolation area. All individuals handling isolated horses should wear disposable gloves, coveralls, and rubber boots or boot covers which can be disinfected in a foot bath prior to entering and exiting isolation areas. All disposable clothing and gloves should be changed between horses and removed when exiting isolated areas. Hand wash and sanitation areas should be established in the isolation areas, and hands should be sanitized prior to and after handling each horse. Foot baths with the appropriate disinfectant solution should be placed in front of each stall, and after a horse is removed from the isolation area, the stall should be cleaned with detergent and then disinfected in accordance with label instructions. Manure, soiled bedding, and waste produced by isolated horses should be removed in accordance with local or state regulations. Your local public health department, local environmental control agency, or state veterinarian will be able to assist you in establishing the proper protocol. To minimize the risk of transmission of disease through insects or rodents, insect and rodent control protocols should be established. Insect repellents should be applied regularly to isolated horses, and you may consider treating infected horses for ticks under the supervision and direction of the treating veterinarian. Rodent and insect traps should be used in and around the isolation area. Feed should be kept sealed in containers, and hay stored up off the ground on hay pallets if possible. In addition to the items mentioned above, also plan to obtain general supplies to be used strictly in the isolation areas, such as digital thermometers for each impacted horse, trash cans with secure lids and heavy-duty garbage bags, additional sharps containers, paper towels, feed and water buckets for each horse, extra spray bottles to fill with a suitable disinfectant, and any additional items as recommended by your competition or state veterinarians.